All right, so this is going to be an intradermal injection. Before we do intradermal injection, we're going to walk through what is intradermal injection, what should we be looking for, and also what precautions should we take while we're doing an intradermal injection. So anytime our patients come in for intradermal injection, the provider will have to put the order down. So when the provider will put the order down, then we come in the room and talk to our patient. There are certain questions that we have to ask our patient. So we're gonna just start from the beginning here and walk you through it, and then the things what we're gonna watch. So, all right, so I'm gonna be knocking on the door, coming in. Hi, my name is Mojda. I'm going to be your medical assistant today. May I please ask you to confirm your first name, last name, and birthday? You can make it up, you don't have to do it.
Dulce Rivas, 10/25/2002.
Is that a real one?
Yeah.
Oh, okay. Well, Miss Dulce, it looks like you're here for a skin test for your tuberculosis. TB is for tuberculosis. Is that correct?
Yes.
Perfect. Before we do anything, are you able to come back 48 to 72 hours?
Yes, I am.
Okay. So as she said yes in here, that was my first question to ask before I do anything. Are you able to come back 48 to 72 hours? If we don't ask that question to our patients, they don't know when is their window time. And if they miss that window, we have to do the whole thing again. If they come before that 48 hours, then we have to have them sit down and wait. But if they come after that 72 hours, it's invalid. We have to do the whole thing again. And by coming back is for the reading. So we will inject the medication into the patient's forearm, and then they come back for the reading in 48 to 72 hours. This kind of testing, we call it we can also use this for allergy testing, which can be on a forearm or in the back as well. So before I get these started, I want to make sure which arm my patient wants it, and then I'm going to observe the arm. We want to make sure that there's no redness or no scarring. Tattoos is kind of hard to avoid, so if you have a patient that their whole sleeve is tattooed, then we can't avoid that, right? So we have to go for it. And then I'm going to show you the measurement, how we measure for intradermal injections. Is it okay for me to touch you?
Yes.
Perfect. Which arm do you prefer?
My left arm.
Okay, go ahead and put your left arm right here. Perfect. So what I'm gonna do is I'm gonna take a close look in here, making sure that there's no scarring, no bumps, no lumps, nothing like that I don't see in an area that I want it to go. So as I'm looking at my patient's forearm here, we're gonna divide it in 3 sections. So this is my first section, this is my second section, and this is my third section. So I want to go on my second section here. We try to avoid going on the sides. We go kind of like the middle area. What else am I covering here? And of course, now that I know where am I gonna go, I have my medication in the room. With the medication, we want to make sure if it's a multi-dose or single dose. If it is a multi-dose, I'm not going to bring this in my patient's room because it's going to be contaminated. So we're just going to go ahead and say this is a single use, and the provider ordered it. So based on my order, I have in here that this is patient is getting a TB skin test, and the amount is 0.5. Okay? And I have like the 1 ml syringes here. I brought my needle with me. I brought some alcohol wipes and gauze. You want to make sure that you have your supply ready to go. So CDC does not require you to wear gloves when you're drawing medication, but I personally like wearing gloves. Anytime I do draw medication or have to inject the medication, I want to wear gloves. I prefer to do that. So I'm gonna clean my hands. For my vial or for my medication, I'm gonna make sure it's the right medication, it's not expired, and those are all gonna be needed for documentation. So I'm gonna get my gloves ready here. I have my syringe. I'm gonna take that out. I always get some air out first, and then we grab our syringe, twist it with the needle. So safety out of the way. I'm gonna put the amount of air that I want. Let's just say right here, we're gonna go 0.1 cc. I'm gonna bring my stopper at 0.1. If I can see, there we go, 0.1. And now we can go ahead and safety out of the way, open it. And I'm gonna stop right here because I forgot to clean my vial. So we're gonna get our alcohol wipe, clean the vial first, always clean the vial. Even if it's the first time you're using it, go ahead and clean it. Now I'm going to inject medication and the air into my vial. Inject the amount of air in it and get the amount of medication that was ordered by provider. Take it out. Since I'm not done using it, if you don't mind moving your hand for a second. Since I'm not done using my syringe and my needle is still good, so I'm not gonna put the safety on it. I'm gonna do a single hand scope. I'm gonna make sure my needle is not touching anything. And as soon as the cup is in, I can go ahead and close it until I'm ready to use it for my patient. When you're in the clinic, you want to make sure on your syringe you have a label that has patient's information and the medication they are receiving, and there's no bubbles in your syringe. So right now I don't see any bubbles. If you want to and the right amount, and now we can go ahead and get back started. So if you don't mind, go ahead and put your arm back in here for me, please. So with cleaning, we get our alcohol wipes. We're gonna start from the circle and work our way out. Yes, I always clean 2-3 times. I want to be safe than sorry. And I do not come back to the area that I cleaned. I do not wind over the area I just cleaned. I do not blow over it because that's not correct. You should never blow over it. I'm gonna give it a second to dry because it's gonna sting the patient if I just go ahead and work it right away. I'm just gonna have my gauze in here next to me. I'm not gonna really use it, but if I need to do it for a gently tapping, I'm gonna have it. So the angle that we wanna go for intradermal injection is going to be like, they require 5 to 15, but if you can do as close as to the skin, the better it is. So if I'm gonna go, I'm gonna try to do probably like 10-degree angles. And you always want to make sure your bubble is up. So if you wanna come a little bit closer here, so I can show this, my safety is out of the way. There are different ways we can anchor. Anchors means you kind of flat the skin as flat as you can. It's to give you a really good wheel on your patient arm. You can flat it this way, you can flat it this way, or you can flat it this way. The one under your hand that you're gonna inject might give you an extra angle. So if you're not comfortable for that, don't do it. Above it is kind of for safety purposes, just in case you kind of move it, you can poke yourself. That's another reason. So the side is the best way for anchor. So if I'm anchoring it this way, my bubble, the tip of the needle is up. So I'm gonna go ahead and make sure the bubble is up. My anchoring it very well, and I'm gonna go like 5 to 15. My goal is in here to go for 10. And as I'm ready, I'm gonna let my patient know it's gonna be a gentle poke. Ready? Awesome. Very gently insert it right under the skin, and I'm in. Once my hand is holding the syringe, I'm never gonna let that go. And very slowly, I'm gonna start injecting the medication. The goal is here to wanna make sure that we see that wheel. Sometimes patient gets worried that, oh my God, there's a wheel. That's normal. And this is a vantage point, so I'm just gonna, or maybe this is not a vantage point, sorry. The needle's out, safety, sharps. Right that way, safety with the thumb and sharp. Can you come a little bit closer and see the wheel here? So that's the kind of wheel that we want to see. From here on, I'm gonna make sure that we're not using any alcohol wipe in here, and we're not getting the gauze and kind of like massage the area. If there's any leaking, we can get a gauze, gently tap on it. And now my post-op instruction for my patient is going to be, please make sure that you're not rubbing that area with soap. If you are taking a shower, you can just let the water go over it. You do not need to scrub over that area. If it gets any itchy, red, or if it started hurting the area, you want to make sure that you call our office or call 911. And now my documentation. The most part of this is documentation. I am going to keep my patient in the office for like 15 to 30 minutes because I injected a medication for her. So I want to make sure I observe her, no reaction to it, right? So as I am watching her, I'm going to start my documentation. Per provider order, intradermal injection was administered to patient's left forearm. Very important, because by the time she comes back, this might be gone, or there's some other chances that she might get something else in the opposite. So it's very important to document the which arm, right arm, left arm, forearm. Patient was instructed to come back 48 to 72 hours. I also used to like make a window and give it to my patient on their after visit summary. Your return time is from this time, date and the time to this time. It kind of helps them to remember as well. And if you can even schedule them an appointment while you're at it, that's even better. Other than that, there's really nothing else. I believe that covered everything. Do you have any questions? As a student, if you have any questions.
No, I don't.
No? Okay. All right, that's it.